Welcome to the legislative update for the week ending Friday, April 30th. My name is Christine Guzzardo, and I'm a senior employer specialist for all things related to ERISA here at Savoy. I'm going to start with the New York legislation called the Health and Essential Rights Act, the HERO Act. The legislation was created as a response to COVID-19 safety concerns as New Yorkers returned to in-person work and designed to fill gaps created by expiring COVID-19 related executive orders. If enacted, the HERO Act would require the New York Department of Labor to issue enforceable minimum workplace health and safety standards and would also impose significant new health and safety obligations on employers in the state. If Governor Cuomo signs the act, New York employers should be prepared to rapidly comply with the New York Department of Labor standards that should be issued 30 days from the date that the bill becomes a law. Also, in New York news, legislation was passed back in March permitting New York employees up to 4 hours of paid leave to receive a COVID-19 vaccination. And just recently, the New York Department of Labor issued guidance to provide clarification for employers. The FAQs make it clear that employers are not required to pay this benefit retroactively to employees who have already taken leave prior to March 12, 2021, which is the effective date of the legislation. However, nothing in the law prevents employers from voluntarily providing employees with such benefits retroactively. Another question employers had was whether the statute provides up to 4 hours of leave for COVID-19 injections, or if employees would be entitled to a maximum of 4 hours of leave per injection. The FAQs resolved this ambiguity, stating that if a COVID-19 vaccine requires 2 injections, then the employee would be entitled to 2 periods of paid leave of up to 4 hours each, which could be up to 8 hours in total. The FAQs go on to clarify that employees are only entitled to paid leave for their own vaccination. Although the law does not require employers to pay employees for time off to assist a relative or another person in getting vaccinated. Employers may also require employees to provide proof of vaccination in order to receive the leave. The law also does not prevent employers from requiring employees to provide notice prior to taking the leave. In related news, Philadelphia maintains a new public health emergency leave ordinance. It covers all employers with 50 or more employees and permits covered employees to take leave for various COVID-19 related reasons, including to receive the COVID-19 vaccine and recover from injury or illness related to the vaccination. Now, moving on to the West Coast, California could be the first state to allow adults to add parents to healthcare plans. Former President Barack Obama's health law let parents keep their adult children on their health plans until age 26. As we know, that change was so popular, many states have gone further and let adults keep their children on until age 30. So now in California, they may do the same, but for older people who are transitioning into retirement after the pandemic. A proposal in the state legislature passed its first committee hearing last Tuesday. The bill would not be an open invitation for parents to ditch their health insurance plans to join their children. To be eligible, parents would have to meet the Internal Revenue Service's definition of a dependent, meaning they rely on their children for at least 50% of their support. There are some California legislators who are concerned its increased costs for employers and their employees could ultimately prevent it from passing. Another considered risk for employers would be parents who live outside the United States moving to the country to live with their children just to get coverage. While we can't predict whether this bill will pass, it certainly provides insight into what we on the East Coast may find coming our way. And that concludes our legislative update for this week. Thank you for joining us. Have a good one.